Welcome to the Fall Prevention and Management session. The purpose of this is to provide a process for assessment, prevention, and management of falls, and to promote patient safety throughout King Abdullah bin Abdulaziz University Hospital. We will simply begin by defining a fall. What is a fall? It is any sudden uncontrolled event in which a person unintentionally comes to rest on the ground or another level such as chair, toilet, or bed. Here are some facts about falls. Globally, falls are a major public health problem. According to World Health Organization, an estimated 646,000 fatal falls occur each year, making it the second leading cause of unintentional injury death after road traffic injuries. The largest morbidity occurs in people aged 65 years or older. Though not fatal, approximately 37.3 million fall severe enough to require medical attention each year. Understanding the causes of falls is important in developing a fall prevention program. Falls can be classified into accidental fall. It occurs when a patient is oriented but rolls out of bed or trips due to environmental risk factors or a neonate or infant who is dropped by a parent or a caregiver. Assisted fall. The patient was being assisted when the fall took place. Near-miss fall. A sudden loss of balance that does not result in any fall or injury. This includes a person who slips, stumbles, or trips, but who is able to regain balance. Developmental fall. Non-injurious fall that is common to infants, toddlers who are learning how to walk, pivot, or run. Unanticipated physiological fall. A fall that is attributed to physiological cause, but the occurrence of condition could not be predicted. Examples are patient having seizure or patients experiencing fainting. Last is at witness fall. It is an event when a patient is found on the floor and no one is aware of the events. Given the complexity of fall prevention, the task of implementing a program may seem daunting. To simplify things, we have broken down fall prevention activities into separate steps, and this includes universal fall precaution, standardized assessment of fall risk factors, care planning and intervention, post-fall procedures. Let's talk about universal fall precaution. These are the cornerstones of any hospital fall prevention program because they apply to all patients at all times, regardless of fall risk, keeping the patient's environment safe and comfortable. They apply across all hospital areas and help safeguard not only patients but also visitors, staff, in many cases. So nurses, always remember to be safe. What is safe? S for safe environment. Side rails up, pathways are clear of clutter and tripping hazards, bed and chair brakes are on for transfers, lights are working and on as required. A for assist with mobility. Safe and regular toileting, recommended mobility aid within reach, documents assistant required for transfer or mobility. F for family and patient-centered. Discuss risk factors for falls, develop fall and injury prevention plan based on the patient's goals and abilities. E for equipments. Call bell, glasses, hearing aid are within reach. Bed lowered to patient's knee height. Frequently used items are within reach. Non-slip footwear available and being used. After universal fall precautions, a standardized assessment of risk factors for fall is the next step in fall prevention. This can be best accomplished through a standardized assessment of fall risk factors. Conducting a fall risk assessment within 4 hours is the responsibility of a nurse to establish the level of fall risk. Both inpatients and outpatients, including delayed admissions in the emergency department, are assessed for fall risk using appropriate assessment tool for patient population. Let's now proceed with the identification of patients at risk for fall. Identification of patients who are at risk of falling is a critical component of any fall prevention program. Most falls are multifactorial, and the more risk factors a person has, the greater the chances of falling. Risk factors may be intrinsic or extrinsic and must be examined on an individual basis. It must be noted that the cause of fall in one patient may not be the same for another patient. When a risk factor is identified, designating a system of communication to every staff must take place and correction action should follow immediately. Here are some examples of intrinsic factors. And here are some examples of extrinsic factors. Always remember, extrinsic factors can be avoided in any hospital setting. Here are some key points to remember. Patients who experience a fall during their admission will automatically be classified as high risk, and patients who are completely bedridden will automatically be placed in low risk. Here in KAAUH, we have two approved assessment tools for falls, namely the Morse Fall Assessment Tool for adult and the Humpty Dumpty Fall Assessment Tool for the pediatric patients. As you can see on the screen, here is the Morse Fall Assessment Tool for adult. It is a rapid and simple method of assessing patients' likelihood of falling. It is quick and easy to use. It consists of 6 assessment criteria, namely history of falling, secondary diagnosis, mental state of the patient, use of ambulatory aid, IV or heparin lock, gait, and transferring. The score is then tallied and recorded on the patient's chart. Risk levels and recommended actions are identified. As you can see on the screen, you can see there the Morse prevention and management interventions. On your left side is the Morse fall risk scoring, and on the right side is the management and interventions. As you can see on the screen, this is the Humpty Dumpty scale. It is a special screening tool developed assessment for children who are at risk of falling. It contains 7 dimensions that assesses age, gender, diagnosis, cognitive disorders, environmental factors, response to surgery, sedation, anesthesia, and medications. Individual items are evaluated on the scale of 1 to 4, where 12 points or more indicates high risk of falling. The tool is designed as a primary and secondary health care for children, ages 3 to 18 years. Low risk of falling was indicated by the scores ranging from 7 to 11 points. Children with high risk of falling scores 12 points or more. In your screen, you can see the Humpty Dumpty prevention and management interventions. On your left side is the Humpty Dumpty scoring, and on the right side is its management and interventions. In addition to the universal fall precaution, a fall risk bracelet will be applied on the patient's wrist, and a fall risk sign will be hung inside the patient's room. How often is the assessment of fall risk factors done? Nurses, always remember FOX. F for after fall. A, on admission, including delayed admissions in emergency department. C, change of condition. T, upon transfer to another unit. And S, every change of shift. Knowing which patients have risk factors of falls is not enough. You must do something about it. Care planning guides what you do to prevent falls. This includes planning for any risk found on the risk assessment tools such as mobility challenges, medications, mental status, and continence needs. It also includes planning around the patient's personal risk that may not have been captured by the assessment tool. During assessment, additional referrals must be initiated to pharmacy and rehabilitation when the patient meets the following criteria. For the pharmacy services, below are the criteria. Patient is more than 60 years old. Patient takes 2 or more high fall risk medications like benzodiazepines, diuretics, anti-diabetic drugs. And last, patient has a history of fall within the past 6 months. For the rehabilitation services, below are the criteria. Patient is more than 60 years old. Patient has a history of falls within the past 6 months and has a mobility impairment. Patient and family education is essential to the success of fall prevention program. Designation should be made on who will be trained, when and how often training will occur, and what will be included in the training sessions. These sessions should include staff at all levels, patients, and their respective families. The following are the list of suggested topics to consider as part of staff training. Purpose of fall prevention, types of falls, management of fall and reporting, post-fall risk assessment and action plan, common risk factors, assessment forms, method of staff notification of individual at risk, environmental and equipment safety checklist. Education to patient and family must include the following: purpose of fall prevention program, fall risk assessments, which includes individual, environmental, and how to report unidentified risk. Explain the purpose and application of restraints, the alternative use of restraints, the criteria of release of restraints, the plan of care, and the patient's rights. Steps taken after a fall occurs, evaluation process after a fall occurs, preventive strategies for the individuals, and how the fall prevention program is evaluated. Despite the best efforts of implementing effective evidence-based post-fall assessment and management procedures, patients will nevertheless fall. Some may even develop complications from injury when a fall happens. A thorough assessment of the patients for any injuries in a systematic way needs to be done, and prompt investigations is required to ensure timely identification of risk factors and circumstances that contributed to fall and management of injuries sustained. Close observations and monitoring following a fall is a critical factor of the post-fall management care plan. As a patient may develop symptoms at a later time that can indicate serious changes in their condition, especially those who are badly injured and those with presenting comorbidities. If a fall occurs in an inpatient settings, the following actions will be taken by the staff nurse: call for help and attend the patient immediately, assess patient for injury before attempting to transfer the patient to bed or chair, monitor patient's vital signs and level of consciousness, notify the most responsible physicians immediately to examine the patient, implement high fall risk interventions throughout the patient's hospitalization, document fall occurrence as well as the management and interventions must be documented in the patient's medical records. Initiate referral to pharmacy and rehabilitation services to assess the patients within 24 hours. Notify all healthcare members and the patient's family of the patient's fall. If a fall occurs in the outpatient setting, implement the following actions: call for help and attend to the patient immediately, assess patient for injury before attempting to transfer the patient to bed or chair, monitor patient vital signs and level of consciousness, notify the most responsible physician immediately to examine the patient, refer the patient to the emergency department if patient injury requires further assessment and care. Post-fall assessment is an integral component of any hospital fall prevention and management policy because it offers a room to detect the most likely cause of the fall. A post-fall degree of injury shall be assessed by the physician within 24 to 72 hours after the event, and a fall severity is assigned in utilizing the following fall severity index: none. The fall resulted in no injury or disability. Minor. The fall resulted in application of a dressing, ice, cleaning of a wound, limb elevation, or application of a topical medication, a bruise or an abrasion. Moderate. The fall resulting in suturing application of stair strips or skin glue, splinting, or muscle or joint strain. Major. The fall resulting in surgery, traction, a fracture, or required consultation for neurological or internal injury. Death. The fall resulted in the person's death as a result of injuries sustained from the fall, unable to determine. A conclusion cannot be drawn from the documentation. After stabilizing the patient, a prompt care was given, conducting a quick post-huddle in an inpatient setting is an integral part of the post-fall management in order to determine the circumstances that caused the fall, as well as to change the plan and educate the patient and family on ways to prevent from happening again. Here are the steps to the post-fall huddle. Team leader makes announcement. Convene within 15 minutes with the patient in the environment where the patient fell. Conduct analysis. Determine type of fall. Team leader summarizes information gathered from the post-fall huddle, and interventions to preventions and repeat fall are decided by the huddle team. Primary nurse completes documentation in track care or downtime forms. Modifies the fall prevention plan of care, includes interventions to prevent repeat of fall. Communicate updated plan of care in patient handoff reports. After post-fall huddle, the nurse manager should follow up the staff to ensure interventions are implemented and with the patient to make sure the patient understands the interventions being implemented and to prevent the repeat of fall from occurring. The nurse manager then can also answer any questions or concerns from the family or from the patient. If the patient falls despite the best measures implemented, proper reporting and documentation must be implemented in order to communicate fall incident to other healthcare staffs, and necessary preventive measures will be implemented. Any incidents of patient fall must be reported through the safety event reporting by the staff who witnesses or attended the incident. Regular reports on incident of falls will be generated by the Quality Improvement and Patient Safety Department and sent to relevant department heads, chairman in an effort to reduce the number of falls and injuries due to falls. Identify prevention factors, learning opportunities, and trends related to falls. Enhance patient care and safety. Improve organizational performance. Patient education must be documented in the patient clinical record and on the multidisciplinary patient family health education record form. All assessment and reassessment findings and plans of care shall be documented in the appropriate forms and sections of the patient medical record. Please take note that after fall event, documentation by the primary nurse in the track care or downtime forms will be made using the Morse or Humpty Dumpty assessment tools. Interventions and post-huddle time will be noted in the nurse's notes. So nurses, fall prevention deserves your attention. Shukran jazilan.